A third of women with incurable breast cancer feel their worries were simply dismissed by doctors and nurses. A damning report reveals that some were sent away by GPS when they first sought help with symptoms, while others were told they needed to just get on with it. And when the illness was eventually diagnosed, women said they felt very alone and were not offered vital information and support. The report, which examined the experiences of nearly 850 women with incurable breast cancer, also found 1 in 5 of those who had previously had the illness were initially misdiagnosed by GPS when it returned. Half were on their own when doctors broke the news. They were not advised to bring a loved one. 1 in 5 had to wait at least 3 months between first having symptoms and seeing a specialist doctor. Some 8% were only diagnosed in a fatigue. But many women said they were initially sent away by GPS with painkillers. 1. A mother of 3, was denied a scan by her family doctor who diagnosed backache and told her to just get on with it. It is not known how many of these women could have lived longer if the illness was picked up sooner. But the charity says that delays inevitably lead to needless suffering and pain. Samia Al-Kadi, chief executive of Breast Cancer Care, said, "Our findings uncover the extent of inadequate care for people with incurable breast cancer, from feeling they're not taken seriously, to facing avoidable delays. This is unacceptable." The charity is urging the NHS to introduce guidelines for GPS on the early signs of secondary breast cancer. Currently doctors are only told what to look for with primary breast cancer. The report is mostly based on questionnaires of 841 women, as well as an analysis of the NHS's Cancer Patient Experience Survey of 71,000 patients. A total of 31% of women said they felt doctors hadn't listened to their concerns either before or after the diagnosis. Another 49% said they were not told to bring a friend or relative to the appointment where they were told they had incurable cancer. This compares to an average of 80% who were urged to bring a loved one when told they had other forms of cancer, many of which could be cured. The NHS was last night yet to respond to a request for comment.
The earlier breast cancer is diagnosed, the better chance it can be cured. So how can we be breast aware? I've come to Imperial College London to speak to Charles Coombs and find out more. Charles, does being breast aware mean that we should be examining ourselves?
It means that women should look at their breast in the mirror and look for obviously any lumps, any signs of a change in the shape of the breast, thickening of the skin, dimpling, that sort of thing. If you notice a lump or a change in shape, you should go and see a doctor.
So finding a lump doesn't necessarily mean you have cancer, it could be completely normal?
Most lumps in the breast are benign. I would say probably 90% of the time.
So what other symptoms, aside from lumps, should we be looking out for?
Well, some women experience a nipple discharge, and that is quite common. But if it's blood-stained, then that is an important sign to go and see your doctor with. Oddly enough, pain is more likely to be what we call benign. But pain that perhaps is persistent and doesn't change with your periods, that is important to take note of.
If someone has any of these symptoms and they go visit their GP, what is the doctor going to do?
Well, the first thing the doctor will do is to take a history and examine the patient. The GPs don't normally do x-rays and biopsies and i.e. needle tests. That will be done by a specialist in a breast clinic in the hospital. When the patient goes to the hospital, they will re-examine and then do a mammogram, and may also do what's called an ultrasound, which is another sort of scan, and may also do a needle test, where they put a needle in the breast and take out some cells for examination.
I understand there's also a screening programme involved. Can you explain to me what this is?
The screening programme in the UK is, on the whole, from 50 to 70. Women, if older than 70, can request continued screening. What it consists of is a mammogram only. It takes a very short time.